Atrial fibrillation is common. The prevalence will only continue to grow as the population ages. So millions of people in the United States are at risk for or have atrial fibrillation. The concern with atrial fibrillation is that it will put you at the risk of a stroke. So as the top chambers beat in an uncoordinated fashion, blood can pool, it can form clots. Those clots can then go to your brain and cause a stroke, or they can go to other organs to cause problems. You might have shortness of breath when you exert yourself. You might have lightheadedness. You might have some chest pain. You might have dizziness. Fatigue is a big one. Sometimes your heart can race relatively rapidly, and that can be quite disturbing or anxiety-provoking. The biggest risk factor is just getting older. So as you get older, you're more likely to have heart rhythm disturbances. There can be other modifiable risk factors for atrial fibrillation. So if you're overweight, or if your blood pressure is not well addressed, or if you have sleep apnea, those can all contribute to your risk of atrial fibrillation. So the treatment of atrial fibrillation, we usually think of it in terms of 4 pillars. The first pillar is, why are you having atrial fibrillation? It could be because you have a strong family history of atrial fibrillation, or maybe you're overweight, maybe your high blood pressure is not controlled. So we look at risk factors for atrial fibrillation, we try to address those. The 2 or 3 other pillars are, what can we do about the rhythm itself? Should we get you out of it? Should we try to prevent it from recurring? What do we do about the heart rate if and when you're in it? And then what do we do about your risk of stroke? Should we offer you what's called a blood thinner or an oral anticoagulant to reduce your long-term risk of stroke? What can you do to prevent yourself from having atrial fibrillation? It's tough. You can't change your family history, you can't make yourself any younger, but you can address the modifiable risk factors. So weight management, a healthy diet, exercise, a moderate degree of exercise is important. And then treating some of the other modifiable risk factors like sleep apnea. So if you have any sleep disturbances, that may need to be addressed with CPAP machines or therapies like that. If you ever have significant symptoms, if it's dramatic, you're having severe chest pain, you're having severe shortness of breath, you probably need to come to the emergency department, and you probably need to call 911. If your symptoms are less severe, they're kind of mild, I would recommend you touch base with your primary care provider first, or arrange to be seen here in the cardiology clinic, and we can certainly evaluate you. We're always happy to assist in that process.